It's good to be clear on the difference between visceral and subcutaneous fat. Visceral fat sits in the abdomen, under the muscle, and it surrounds and is in between your organs. It's referred to as abdominal fat often, and having too much of this is inflammatory and it increases the risk for several chronic health issues, including dementia. So, subcutaneous fat, on the other hand, is right under the skin and it can be all over the body. And it's the fat you can pinch. This fat is less dangerous than visceral fat. So, let's go back to visceral fat. Visceral fat is associated with higher insulin levels. And again, it's inflammatory and it's actually metabolically active, meaning it produces chemicals that go throughout your body. It doesn't just sit there. So, how do you measure visceral fat? First of all, the first way you can do it is to get your hip to waist ratio. So you're going to want to measure your waist circumference and then measure your hip circumference. And if you're a woman, you want the ratio to be less than zero 0.8. If it's over zero 0.8, you likely have abdominal visceral fat. And it's more common than you think. There are some other signs that you might have visceral fat. Here they are. If your fasting insulin is over 5, if you have small, dense LDL, if you have elevated CRP, which is C-reactive protein, it's a measurement of inflammation in the body, if your liver enzymes are high, or if you've been told you have fatty liver, if you have elevated uric acid, or if you have high triglycerides and low HDL. And these are even functionally elevated or low. So maybe not even to the point where they're flagging your medical provider, but we want those numbers to be optimal. Okay, the causes of visceral fat. Why do we get visceral fat? According to Mark Hyman, reasons might include foods like sugar and starch, processed foods, but also losing muscle mass, especially as we get older, poor sleep, excessive stress, even toxins like BPA, heavy metals, or obesogens, imbalances in the microbiome, food sensitivities, mold, chronic infections like Epstein-Barr. And it is genetically influenced, but we definitely have control here and can impact this with food and lifestyle. So, how do we get rid of it? Visceral fat is really not about reducing calories. So it is about improving insulin sensitivity, which are things that we're working on here together. So some people, probably most people, need to reduce refined or processed carbs, okay, and like all processed foods. And temporarily, someone may need to avoid grains, beans, and fruit even while they become more sensitive to insulin. Getting more fiber, fat, and protein will help, reducing stress, improving sleep, actively building muscle. Things like drinking green tea can even help. Optimizing omega-3 fatty acids to help improve that LDL HDL ratio is helpful. And finally, optimizing the microbiome is really helpful, of course. So a lot of the women I work with are surprised to learn that they actually are gaining visceral fat. And this was actually happening to me also, especially this can happen in late perimenopause and then menopause as estrogen declines. Again, our sensitivity to insulin changes. So that's it for now. If you have any questions, reach out. If you have any thoughts, feelings, anything like that, head over to Facebook. Let's get this conversation started. Thanks.